All right, we're in the home stretch. So thank you to the organizers for the invitation to speak. Things are wonderful down under, but it's lovely to get back home as often as I can as well. So I'm going to talk to you about an integrated approach to workplace mental health and what that might look like in small and medium enterprises. My work, I do work in small, medium, large enterprises. I'm not a specialist in SME, but I have some experience there that I'll talk about. So just to acknowledge, I won't go through all of this. The work that I will speak of comes from many minds. There's a bunch of them along the right side from my small group. And then collaborators here in the States and overseas in other places as well as Australia. So here's what I want to do. I want to do the talk in two parts. The first bit, speaking to you, the researchers, practitioners, policymakers, about what I mean by an integrated approach, which is really a total worker health version when we focus on mental health, basically. And then I'm going to switch and do a bit of a role play and try to sell the idea to a small business owner or manager. We'll see how that goes. Okay, so how do we arrive at this? Well, talking about workplace mental health it's complicated. Well, all of our work is complicated, but I found when I would go into workplaces to talk about this, I had too much to say, would overwhelm employers, and they'd just like, cut to the chase, will you? Really what they want to know is what they can do. Usually if you get in the door, they have some motivation to act, and that's what they usually want to get to quickly. So we tried to, through many discussions over a couple of years, to distill things to distill what we would do in workplace mental health to its essence, make it concrete, accessible, without jargon. And so this is it. So when you talk to somebody, you say, well, what you need to do is prevent harm in the workplace. That's traditional OH&S. You can also promote the positive aspects of work. That brings in some new stuff. And also, when things arise, you got to deal with them, whether they're work-related or not. And so that's the integrated approach. And now let's walk through a little bit, unpacking that for you. This is the same thing in words. To say a little bit more about protecting from harm, the risk factors might be work-related or they might be related to life outside of work. Both are in scope. In promoting the positive, you might be promoting well-being for well-being's sake as well as worker health. And finally, with respect to addressing mental health problems as they might manifest at work, sometimes people bring mental health problems to work, sometimes work brings mental health problems to people, and often it's a combination. But it doesn't matter. You have to deal with it regardless of cause. Now, the interesting thing about this is it comes from what we're trying to do here is bring together three threads of sort of parallel developments in workplace mental health. On the left is where I come from, which is OC Health, public health side. The middle is the new kid on the block, which is coming from organizational development, positive psychology. And on the right comes from the illness end, psychology, psychiatry. And really, the approaches to workplace mental health evolved sort of in parallel in each of those. And what we tried to do is try to pull that together. So let's step through each of them, just a sort of a whirlwind tour, if you will. What to do about working conditions that affect mental health? Well, there's loads of systematic reviews. Lisa has covered a lot of this hierarchy of controls, focus on the work as well as the worker. I don't think I need to go through that. Many of those words are synonyms there for different sort of systematic approaches to dealing with it. But a problem with stressors and job stress at work is every context and every situation is unique. There's no machine guard for job stress, sadly. That would be nice. And so dealing with stressors, the work-related aspect of stress, is unique in each context and even between workers within workplaces. This is what slows employers down because you have to do the hard work in every context. So what do people do? Prevalent practice is disproportionately focused on the individual, same echoing Lisa's message in the last talk. When we ask employers what they do about it, they say, well, we have an EAP. And that's great. An EAP is a great source, an employee assistance program, but it's not exactly focused on working conditions. Stigma issues are alive and well for stress, can't stand the heat, get out of the kitchen, as well as stigma against mental illness. Those are two different things, but related. And in Australia, and probably the same here, the first response as workplace mental health, and here I'm sure it's the same, it's the only stress-related claims are the only group that are on the rise. While MSDs, musculoskeletal disorders, are falling, fatalities are falling, that's all great news, while stress-related claims are rising. And in Australia, our first response was an insurance response, make it harder to file a claim. So that's an insurance response to a public health problem that just exacerbates things. That's changing in Australia, and I hope it's changing here. You can even talk about suicide in work in Australia. When the first time I said that to the insurance providers, they said, oh, we don't use that word in relation to stress claims. But anyway, so things are changing. It's important to note, and it's going in the right direction. So to summarize that first arm there, the dominant focus should be on working conditions and stressors, because that's employers' legal and ethical mandate. Can also focus on non-work-related risk factors for prevention, strong on the primary, secondary end, weak on the tertiary, little on promoting the positive, and it's negatively framed. This is our baggage in OH&S. We're always negatively framed, averting risk, and so on. And so enter promoting the positive, a little bit of a counterpoint to our traditional focus in OH&S. Just a little bit of sort of background. This is an area that I've had to learn about in the last several years. It's been really interesting, so I thought I'd give a little bit of background to you all, thinking you might be in the same situation. So ideas of complete health and complete mental health go back to the WHO in the 40s. Many of you will be familiar with this, not just about the absence of illness, but the presence of positive feelings, positive emotions, positive functioning. Some of you will have heard of eudaimonic and hedonic well-being. Eudaimonic is meaning and purpose. Hedonic is positive feelings and emotions. And complete mental health, as Corey Keyes and others put it, is flourishing or being highly functioning in social and psychological sense with positive feelings in the absence of mental illness. And interestingly, you can be mentally ill and actually have high well-being. It's not common, but it's actually possible. So flourishing is combining the absence of mental illness with the presence of positive well-being. So in the workplace, the overall aim would be to promote that for individuals, but also to promote that at an organizational level. And it's positively framed, so instead of avoidance goals, risk management, and so on, you have approach goals where you're aiming for aspiring towards something. It's usually based on strength-based methods and in pursuit of a positive outcome, be it well-being, employee engagement, for instance. Some examples of strength-based methods are appreciative inquiry, future search. I'm not sure how many of you are familiar with these, but we can discuss them after if you like. And a few examples are focusing on positive or supportive management in order to improve, for example, in stressor terms, job control for those supervised by that manager, supervisory support, and that would improve the psychosocial working conditions of the supervisees of that worker. Workplace social capital, focusing on respect and dignity at work, are essential and simple and not costly to do, and very humanizing. So there's a few examples. What's the evidence it works? There's a little bit from the general literature around, around well-being and positive psych, and interestingly, it has the greatest effects on those with depressive symptoms. When you restrict this to studies that have been done in the workplace, it's not that many. It's not a very big literature yet, but one systematic review came out a few years ago, and they do see evidence that you can enhance employee well-being, mixed evidence of it improving performance, which obviously is a driver for organizations as well, and there's also evidence that in addition to promoting well-being, that it reduces stress and stress symptoms, depression and burnout. We did some work where we looked at positive mental health as an effect modifier of the stressor-mental health relationship, and as you'd expect, positive mental health is a strong buffer. And so in addition to positive mental health promoting or being a well-being positive, it's also protective against mental illness related to stressors. So you get a bit of a double value. And of course, just like the first thread that we talked about, you can use the workplace setting to promote work-related protective factors against non-work-related protective factors, such as physical activity. It's protected against mental illness and also promotes well-being, as well as for general purpose. Mindfulness training is all the rage in workplaces, as many of you will know. And it's more likely to be engaged with by employees if the employer is walking the talk. and looking at first improving the quality of work before telling people to be mindful and grateful. So limitations, summarizing that thread then, the limitation is it's mainly focused on the individual. That's where it's come from. But people are moving up to the team, group, organizational level in terms of how to pursue this. It can also have that double value I mentioned in both promoting well-being and protecting from illness. But it is the least developed of the three threads. And as I say, the new kid on the block. So on to the third thread then. Here, in the last decade, just to sort of cut to the chase here, the main thing in this space in Australia, and I think internationally as well, is that mental health literacy and the anti-stigma campaigns have been the main focus here, the new bit in workplaces. And mental health literacy basically means helping people understand what mental illness is, that it's common, it's usually treatable, doing anti-stigma messages, it's not a sign of personal weakness, for instance. And then, most importantly, helping skills. So if you think someone's experiencing a mental health problem, how do you talk to them about it? How do you not talk to them about it? And how do you direct people to appropriate sources of help or support? That's a little different for a manager, because a manager needs to be very mindful of anti-discrimination, disability employment, OH&S, and probably a few other laws. And so this is something that's, that's a little bit more involved for managers than for workers. And here are a few examples of awareness-raising activities as well as the National Workplace Mental Health Literacy Initiative that we have had in Australia. Employers love this. They open the doors for this all the time. There is evidence of effectiveness. I'm going to skip over some of this. You probably, well, just in the interest of time, we'll move on. So to summarize this, it's really illness-focused, strong on the tertiary end, little on promoting the positive, some evidence of effectiveness, and strongly embraced by employers. So this is elaborated on at greater length in some previous papers and in the Total Worker Health volume that NIOSH is putting out sometime soon. Some examples of it in the SME context and in policing that we've been doing in recent years. So how do you sell this to a small business owner? So we've got the sympathetic owner who says, what should I do about workplace mental health? Okay, well, you need to think about three things: preventing harm, promoting the positive, and dealing with problems as they arise. You don't have any choice. Well, is all that necessary? That sounds like kind of a lot. Well, mental health problems are common. How big's your organization? Here's 100 people in the working population. 1 in 5 of them has a problem. About the dark shaded figures are people with a severe mental illness. Most commonly, it's mild. If you're 10 people, you'll see there's 1 or 2 that are going to be in your workplace in all likelihood. You may not be aware of it. It doesn't affect a lot of people's ability to function in the workplace, but it's an issue. So you're likely to encounter it, and if you're formally an employer, you have obligations under various types of laws. So what about these how is work affected? Well, job stressors can cause depression, anxiety, suicidal thoughts and behaviors, and so on. And in your case, think about yourself as a small business owner. This is echoing the conversation this morning. You've got great job control and flexibility, but you've also got probably very high working hours. You're personally invested in this place, speaking of precarious business as well as precarious employment. Your work-life balance might be good, might be bad. Your security is reflective of the status of your business. And it's hard to take leave, right? You feel sick, you're probably going to have to go to work anyway, and you probably don't get enough vacation. So that's not stacking up good for your mental health, and that's perhaps one of the places you could start, is looking at yourself. But, you know, we're small, we don't have the resources. Well, you start small. Just do awareness raising, create an environment where people can talk about these things. Are you part of a network of some kind? You know, join up and get yourself some training that way. Informal approaches are as good, or perhaps even better, than formal approaches, especially as you're getting going. But all that stuff out there, they don't understand small business. Well, historically, that's been the case perhaps with health and safety and workplace health, but it's changing. And there's a growing range of materials designed specifically for small businesses. There's a few examples here, and we can help you navigate this stuff on the web because, as you know, when you do a search, you experience an avalanche. Here's an example from a National Depression Initiative in Australia. new set of web pages for small business. Notice the one in the upper right, looking after yourself as a small business owner. That's a good place for you to start. Okay, so you telling me now I'm responsible for my people's mental health? No, 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 no. Don't worry. But what you are responsible for is providing work that's not harmful to mental health. And you also would want to know what to do if a problem arises, because you're going to have to deal with it if you haven't faced it already. So suppose I give it a try. Where do I start? Well, you plant a tree. It's not, you can see why I'm a researcher and not an artist by the tree there. And you know, you start with something on each branch as you go. You're probably doing more than you think already. Do you talk to people about how they're doing? Do you ask if we need a little bit of temporary help in peak periods, for instance? Well, that's assessing risk and responding and controlling. So these are important things. Do you follow up on people when they say they don't have the things they need to do to get the job done? That's OH&S. You know, that's dealing with people's workplace mental health. Running a small business means you got to provide the resources to deliver the service or the product on the other end. Same thing with job stress. You want somebody to do a good job, you got to give them the resources, the support, the materials, the equipment in order for them to deliver for you on the other side. Failure to do that means they can't get the job done, and that hurts your business. So really, good business and job stress prevention are the same thing. Are you already promoting the positive? Well, do you know your staff's strengths and weaknesses, what they like about their job? Well, if you do, is it possible for you to give them a bit more about what they like? Then maybe they'll be a bit more engaged. Say you got Sally, the accounts manager, and she's a bit disengaged lately, and it turns out she'd like to get her head out of the books and do a little more interacting with clients. So you progressively share more of that responsibility with her. You were previously doing it all yourself, and she gets more engaged. You're freed up to think strategically or move on to something else. So you're promoting the positive at the same time you're being smarter and running your business. So this stuff is not terribly different from running your business well. Responding to mental health issues as they arrive at work. Well, I'm running low on time here, so we'll skip ahead a little bit. But basically, tell us about how you deal with sick days now. Let's start there as one of the things we do. And stigma against mental illness means people might not be telling you that they're taking a sickie because they're mentally unwell because of stigma against it, but that can change. The key thing you need to know is what I've mentioned earlier, is how to recognize signs, direct people to help, not necessarily diagnose them, and support them in doing their job, not solving their mental health problem. So what next? Well, there's a few things you can do. Awareness raising, web-based work, get together with your networks, some one-on-one discussions about what's going well, what's not going well in your workplace, and trying to react to those things. Use a few of these resources. They're about 20 minutes to half an hour each. They can be done in a group or self-administered, and there's no cost associated. There's more things that we put together that you could use as well. Next year when we talk, maybe you take something on every 6 months or yearly. And I hope from that you've got a concrete sense of what this is about, and you're probably on the way already, and you could simply see this as doing good business, good management. And you'll benefit yourself from this outside of work as much as at work, as well as your staff. So plant your tree, water it, do all those nice things, and over time, you'll have a lovely thing. It should be an aspen with golden leaves, I'm sorry. But, you know, and you start small, and you can get there. Thanks very much. Yeah.
Phoenix, I basically want to just sit at your feet and learn.
Right.
We have time for a few questions for Tony. Yeah, Josh.
It actually works. Great.
Yes.
So, you know, we were talking the other night that we've been engaging in a lot of this work, especially in some of the mountain and rural communities in Colorado. And if you would even go back one slide, if you can.
Sure.
One more.
That's the
one
best
more. No,
one,
I mean,
yeah.
I like your tree. Even one more. There we go.
Yeah.
So, you know, one of the challenges that we face in facilitating this conversation is that, you know, in the Front Range, we are resource rich. So folks who are seeking, you know, who want the resources around managing illness, that kind of that part of the tree, they know where to direct people and how to direct them and where to go. But in rural communities, they're missing that piece of this interdisciplinary approach. And so, you know, we really focus on what you can do from, you know, normalizing it, promoting the positive, destigmatizing it. But when you really are, from a community standpoint, lacking the resources to manage the illness, how does that conversation change? Or what is what's the starting point rather than, because that keeps filtering back to there is what the problem I have.
So, all right, so let me see if I can distill your question. So you're asking what to do, so if a small business owner does some of this, and then someone with a mental illness is identified who can't get the support they need, is that what you're saying?
Yeah, it's just they're lacking resources.
Yeah, okay. Well, I wish I had a solution to that. We have the same problems in Australia, even with nationalized healthcare, with a healthcare system, which doesn't exist here. But I don't have an answer to that. It's only through lobbying in Australia that slowly there's more and more of a focus on regional rural in terms of service provision. More and more is being done over the wire. I mean, in Australia, people do guided operations over the internet, through cameras and remote and rural areas. There's no reason you couldn't be doing therapy through Skype even. So those are the sorts of things we'd have to do. I mean, solving the mental health, access to mental health services is a little bigger than I can answer. Sorry. I hope that helps.
There's a question over here.
Yes.
Hi, Tony. Great talk. I really enjoyed it. So if you're consulting with this company, when you go back a year later, or even with the first interaction with them, how do you recommend they monitor their progress toward improvement? And maybe you could speak to that for both a large and a small company. Okay.
So when you have the first conversation and you say, well, what are you doing in this space already? You can do a little tree diagram, you as the consultant say. Okay, well, they do check in with employees, and when people are overloaded, they do bring on extra staff. They get it. They're doing these things. They do know how to have conversations. They're aware that you're not supposed to ask people their diagnosis and things like this. There's some level of awareness and sensitivity. And I've recommended they do this, this, and this. A year later, they've done those things, or they haven't, or they've picked up something else that came in obliquely. They made a connection that you hadn't set up. And in terms of, we're not going to recommend employee surveys for a small business, but it's a matter of if you had if you had maybe your once a year barbecue or something the day before, you set an hour aside, what's going well and what's not going so well, what can we build on, what can we improve on, and you get some notes from that, and you check the next year. And you go back to the things that were talked about in year 0 at year 1. Did we actually change that? And you hope that you're talking to the same people, because sometimes you're not. Speaking of precariousness of business and employment, it might be turned over entirely. You might even be dealing with a new owner. So I don't know. In a small business context, it's got to be simple and common sense sort of approach.
Last 2 questions.
Yes, thank you for your presentation. I'm based here in the U.S. and I do safety work. I teach employment law at Catholic University. And to me, this is one of the big challenges, is sort of threading the needle and not running afoul, at least in the U.S., of the various employment laws that are out there. A lot of the companies that I work with, and I have actually dealt with a few situations with clients, one where they had a suicide in the workplace, another where they had an altercation where 2 guys got into it and ended up in the hospital. And you never really know. Are people fighting because they don't like each other? Are they fighting because of mental illness? Was it job related? Was it off the job related? And in the U.S., there is a danger for employers of getting inadvertently too much information. And for small businesses, I think that's especially true. If you're a 1,000-person company, you have, kind of a Chinese wall of an EAP that you can put your people to, and you really never know what they're discussing. Many small businesses don't have the resources to have an EAP, and if you do, are you okay? And, Joe says, well, as a matter of fact, I'm thinking about killing myself. The employer's going to go, oh, crap, I can't have them in here because they might, as they say, go postal and, have exposure. OSHA, for their part in the U.S., has the general duty clause, and they have expectations that employers will have frameworks in place to spot people who may be prone to violence. And so it is, to me, a very challenging thing as I review clients' handbooks for employment law and policies, as well as their safety and health programs. How do you mesh this without running afoul of HIPAA, without running afoul of the Americans with Disabilities Act?
Yeah.
And I don't know if you have parallel laws in Australia, so maybe this isn't as much of a barrier, but I'd be interested in your comments.
No, there are similar laws and similar issues in the U.S., in Australia, but thankfully a lot fewer guns. So there's no simple answer to that question. But it's true, in small business, people tend to know each other really well and know each other's business inside and outside of work. And so as a small business owner, in talking about this, a particular emphasis would need to be on respecting privacy and thinking about things. You know, this, and by coincidence, in the upper right there, that mental health first aid is about reacting in a panic attack. Somebody's saying they're suicidal. Somebody's having an anxiety attack. What do you do before professional help can arrive? But in the workplace, when this is applied, you know, a supervisor should not be providing mental health first aid to a supervisee because they're going to learn things that could prejudice their promotion subsequently, or who needs to get retrenched when it comes around. So these issues are real. There's no simple answers. But for instance, the mental health first aid guidelines, adapting them to the workplace, this is the kind of stuff we've discussed. Those are available open access on the web. So it's only a partial answer to a large question, but I hope it helps a little.
So speaking of large question, we have a short question and a short answer to wrap the session.
Yes.
Okay, thank you for your nice presentation. I will try to stick myself according to the rules crafted right now. This is one of the neglected area in countries like Ethiopia. So one of the three approaches to maintain mental health in small business is managing the illness, right?
Yeah.
So do people return back to their normal position after managing the illness?
Oh, well, they certainly can. This is where...
I'm raising this question because most of professionals say that mental disorder is usually irreversible in its nature.
Oh, okay. Well, all right. So first of all, the most common mental disorders are depression and anxiety, and they're manageable. For most people with depression and anxiety, you probably have worked with many with depression and anxiety and never knew it. And so this is a critical thing to be aware of. Is mental illness is common and usually treatable and manageable. And so that's sort of point number one. And this is a key message of mental health literacy. And in Australia, we've had a national initiative for the last about 15 years, and we've seen mental health literacy in the population rising and stigma falling. Still a ways to go, but you know, this has to happen system-wide, really, for it to be enabled in the work context. Somebody with a mental illness leaves work, that mental illness might be work-related or not, doesn't matter. Returning to work, just like any other return to work plan, if you're limited physically, then you know you don't do the lifting. If you're limited in terms of stress, maybe you're not the front of house dealing with the challenging clients, but you're back of house for a while. You do a reasonable accommodation. That's an obligation of employers, regardless of what the injury or illness is. Applies to mental as well as physical. It's doable.